Hi, my name is Shiji Ebi, and I'm a family nurse practitioner student at South University. And I'm going to do a head to toe assessment today. And Ebi is going to participate with me in the head to toe assessment. Before I came into the room, I already washed my hands. Um, and I saw Ebi walking in. His gait was steady. And I'm going to start with the head and down to toe. Before I do that, I already check the vital signs that include the temperature, blood pressure, pulse rate, respiratory rate, oxygen saturation, and the height and weight, and all of those are in normal limits. I'm going to start with the inspection of his hair. His hair is black and coarse and evenly distributed. He is normocephalic. Next, I'm going to palpate his facial bones, checking for any tenderness. Do you have any tenderness?
No.
Okay. I'm going to check for the frontal sinus for any tenderness and the maxillary sinus. Do you have any tenderness?
No.
Okay. Next, can you smile for me? Puff your cheek out. Close your eyelids tight. Okay. And he did all those successfully, and that shows the cranial nerve number 7, the facial nerve, is intact. Next, I'm going to check his temporomandibular joint. Can you clench your jaw for me? And move your jaw side to side. Okay. This shows that the cranial nerve number 5, the trigeminal, is intact. Next, I'm going to move down to the eyes. His bilateral eyes are symmetrical. I don't see any ptosis. I'm going to look at his sclera. The sclera is white. There's no signs of jaundice. His conjunctiva is pink and moist, and there is no signs of paleness or jaundice. Now I'm going to check the visual acuity. I'm going to use a Snellen's chart, and can you read the smallest line of the alphabets written here?
LTFTH.
Okay, and this shows that he has 20/20 vision, and that shows that his cranial nerve number 2, the optic nerve, is intact. Next, I'm going to check his peripheral vision with closing one of his eye with one hand. Can you close your eyes with the right? Okay, and please let me know when you see my wiggling fingers.
Yes.
Look at my nose.
Yes. Yes. Yes.
Okay, let's do on the other
Yes. 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 Yes.
Okay, next I'm going to check his pupillary reaction to the light. I'm going to use my ophthalmoscope. I'm going to check direct and consensual light response. Okay, his pupils constricted appropriately to the direct and consensual light, and I did see his the red reflex. This shows that his cranial nerve number 3, oculomotor, cranial number 4, nerve number 4, trochlear, and cranial number 6, the abducent nerves, are intact. Next, I'm going to assess his ear. The external ear, the pinna and the auricle, has no lesions or any discoloration. Now I'm going to palpate the pinna. Do you have any tenderness?
No.
No tenderness on palpation to the external ear. Next, I'm going to do a whisper test. I'm going to say 2 to 3 letters, and please repeat after me.
10, 9, 8.
Okay, he repeated that correctly on the left ear. Now I'm going to switch to the right side.
5, 6, 7.
Okay, so he successfully repeated on the right side of the ear. Next, I'm going to check his sound laterality. I do not have my tuning fork right now, but if I would do the Weber test and the Rhine test. Weber test, I would activate the tuning fork and keep it on the middle of his ear and ask him whether he's hearing the sounds equally on both ears. And the Rhine test is to check the air conduction versus bone conduction, and the air conduction is supposed to be twice as long as the bone conduction. Now I'm going to proceed to look into his ears with my otoscope. I'm going to check his auditory canal. His right ear has no redness, no cerumen noted, and the tympanic membrane is gray and translucent. There is no bulging or any perforation seen. Next, I'm going to look at his right ear. The right ear canal has no redness. There is slight cerumen present. The tympanic membrane is gray and translucent, and there is no bulging or any perforation or redness noted. And this shows that the cranial nerve number 8, acoustic nerve, is intact. Now I'm going to proceed to his nose. His nose has slight skin peeling, which is from the sunburn. He went to beach a couple of days ago. I'm going to palpate his nose. Do you have any tenderness?
No.
Okay, no tenderness on palpation. I'm going to use my otoscope to look into his nose. Okay. Nostrils are patent. I did not see any rhinorrhea or any lesions. The nasal mucosa is pink, and there is no enlarged tubercle. I'm going to close one of his nares and ask him to take breath through the other nose. Okay, I'm doing the same on the other. Okay, do you smell anything?
No.
Okay. I checked his cranial nerve number 1, which is the olfactory, and that is intact. Next, I'm going to move down to his mouth. His lips are pink and moist, and there is no ulcerations noted. I'm going to look into his mouth. Let me see your teeth. Okay, teeth is white, and there is no decay seen. Gums are pink, and there is no bleeding present. Open your mouth for me, please. Okay. The buccal cavity is pink and moist, and the uvula is at the midline. This shows that the cranial nerve number 9, the glossopharyngeal nerve, is intact. I'm going to check the posterior pharynx right now. Say ah. Okay. The posterior pharynx is pink and red. There is no exudate seen. I was not able to visualize the tonsils. Can you stick your tongue out for me? Can you wiggle your tongue side to side? Okay, thank you. This shows that the cranial nerve number 12, the hypoglossal nerve, is intact. Next, I'm going to move down to the neck. His neck is midline. I do not see any lesions or any discolorations on his neck. I'm going to palpate for his carotid arteries, and his carotids are 2 plus equal bilaterally, and his trachea is at the midline. And next I'm going to palpate his lymph nodes. I'm going to start with the posterior lymph node, the post-auricular lymph node, the pre-auricular lymph node, submandibular lymph node, submental, supraclavicular lymph node, posterior cervical lymph node. I was not able to palpate any of the lymph nodes. Next, I'm going to move to the shoulder and upper extremities. The shoulders are symmetrical. Can you shrug the shoulder from me? Okay. He has good strength on his shoulders, and this shows that the cranial nerve number 11, the spinal accessory nerve, is intact. Now I'm going to palpate his upper extremity, checking for any tenderness. Do you have any tenderness?
No.
Okay. I do not see any swelling or any discoloration on his upper extremities. Next, I'm going to palpate his brachial pulses bilaterally. And he has 2 plus equal brachial pulse. I'm going to move down to radial, and he has 2 plus equal bilateral radial pulse. Let me see your hand. His nails are pink, and there is no splitting or any cyanosis noted, and there is no clubbing present. I'm going to check his range of motion on his elbows. Can you bend your knee? Extend. Okay. Thank you. Next, I'm going to proceed to his anterior chest. His chest is rising and falling regular, and he is breathing regularly. Next, I'm going to assess his heart on 5 different points. First, I'm going to auscultate on the aortic area, which is on the right sternal border, second intercostal space. Pulmonic on the second intercostal space, left sternal border. The Earth's point on third intercostal space on left sternal border. Fourth intercostal space on left sternal border is the tricuspid valve, and the mitral valve is on the fifth intercostal on the in the mid-clavicular line. And the point of maximal impulse is on the fifth intercostal space on left mid-clavicular line. I heard S1 and S2, and I did not hear any S3, S4, any clicks or any gallops. Now I'm going to listen to his lung sounds anteriorly, laterally, and posteriorly. The lung sounds are clear. I did not hear any adventitious sounds like crackles, bronchi, or any wheezing. Next, I'm going to assess his posterior chest. The spine is at the midline, and I'm going to check for any tenderness. Do you have any tenderness?
No.
Okay. There is no signs of any kyphosis or scoliosis. Next, I'm going to percuss on all the 6 fields. Okay. I hear good resonance, and I'm going to check for the costovertebral angle tenderness. Have any tenderness?
No.
Any tenderness?
No.
Okay. All right. You can sit back this way. Next, I'm going to proceed for the abdominal assessment. Can you lay down, please? I'm going to move the chair. For the abdominal examination, I'll first start with the inspection. The hair is evenly distributed all over his abdomen. There is no pulsations noted. There is no striae or striae present. I see one scar right on top of the umbilicus. Next, I'm going to auscultate the bowel sounds on all the 4 quadrants. He has good bowel sounds on all the 4 abdominal quadrants. Now I'm going to auscultate for any bruit on the aortic region with with the bell of my stethoscope. I'm going to auscultate the renal arteries bilaterally. Going down to the iliac arteries. Next to the femoral artery. I do not hear any bruit on any of the sides. Next, I'm going to do the percussion. I hear the dullness on top of the solid organs like the liver and the spleen, and I heard the tympani on top of the organs like stomach and the intestines. Next, I'm going to palpate the abdomen with light palpation and deep palpation. His abdominal muscles are strong and abdomen is soft. Now I'm going to do the deep palpation. Please let me know if you have any tenderness.
No.
Okay. Next, I'm going to palpate the right border of the liver. Can you take a deep breath in and out? Okay. I felt the right border of the liver and it was smooth. Next, I'm going to palpate for the spleen on the left side. Take a deep breath in. There is no splenomegaly present. Okay. Now you can go ahead and sit up. Next, I'm going to assess his lower extremities. Below his knee, I don't see any redness or swelling or any scars. I'm going to palpate for any tenderness. You have any tenderness?
No.
Okay. All right. Next, I'm going to palpate for the popliteal arteries. I'm moving down to the posterior tibial and to the pedal pulses bilaterally. And I was able to palpate all the three different pulse site, and it was +2 and equal. Next, I'm going to do the rest of the neurological exam. At the beginning of this assessment, I already checked all the 12 cranial nerves, and that was intact. Now I'm going to check the muscle strength. Can you hold my arm and push? All right. He has good grip, equally and equal bilaterally. Push on my hand down. Okay. Pull back up. Okay. And for his lower extremities also, he has equal strength. Next, I'm going to do the sharp and dull test. So I'm going to, you need to close your eyes, and I'm going to test your sense with the sharp and the dull part of the safety pin.
Sharp. Dull. 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 Sharp. Sharp.
Okay, open your eyes. He was able to differentiate the sharp and the dull sensation throughout his body. Next, I'm going to assess the musculoskeletal system. I'm going to check the range of motion on his shoulders. Can you extend your arm, okay, and bring back to your body? All right. Good. And next, I'm going to check his reflexes on the elbow. I'm going to get my reflex hammer. Okay. I'm going to check the elbow reflex. Okay. Next, I'm going to do the patellar. The Achilles tendon. Okay. All his deep tendon reflexes are intact. And now I'm going to test the range of motion of his cervical spine, lumbar spine. Can you stand up? Okay. All right, can you bend your head forward and back up and turn your head side to side? Okay, and twist your body, yes. Okay, and bend all the way down and extend. Okay, and that shows his cervical spine has good range of motion. And here ends my head to toe assessment, and thank you.
Thank you.